An update on prevention and treatment for COVID. CDC Director Dr. Rochelle Walensky says boosted Americans are 97 times less likely to die of the virus than the unvaccinated. And a study from Israel shows what it calls remarkable data that more vitamin D can help COVID patients keep from becoming seriously ill or dying. I wanted to learn more about where the pandemic may be headed, so I spoke with COVID expert Dr. Celina Nadelman. She brings us up to speed on young children getting the vaccine and the recent emergence of the Omicron subvariant.
Now we're seeing a second variant of the Omicron. It's called B2, and it seems to be at least 1 to 2 times more contagious than the original Omicron variant. That means that people are catching it faster and it's circulating more. Some people think that in the scientific community that this may help increase, I'd say, worldwide exposure, either through vaccines or through exposure of Omicron, since it's much more contagious. And that way it will no longer be as novel as it was in the very beginning.
So let's talk about the future of the virus. I mean, there is some scientist that is saying that COVID will always be an epidemic virus. Now, do you think it will ever be endemic? Do you think it will become something more like the seasonal flu?
Possibly. I think that's the direction it's going in. I mean, that's really what, the goal of a virus is to hang around. If it kills off its host too quickly, like I was saying before, let's say it were like Ebola. Ebola, yes, it's extremely contagious and highly fatal, but it kills its host before it can actually go on to the next, country or village or whatever. So yes, colds are very contagious. It goes around, but we don't die from them. So hopefully that's the direction of COVID.
Let's talk about vaccines and children under 5. Officials in Philadelphia are preparing to give these vaccines to these young children if the FDA approves it for this age group. What are the pros and cons of vaccinating children that young?
What we see currently is there aren't that many cases of COVID that are extremely harmful to children. But we don't know. We don't have enough scientific data except for the year. And we see that with the Delta and the Omicron, more and more children are being hospitalized. And those children are the ones that aren't vaccinated. So yes, vaccines do have a certain amount of protection. We do know that children do not usually get such bad disease. But if we're vaccinating or exposing people to COVID, it'd be much safer to vaccinate, and so that everybody gets antibodies, and so that eventually what'll happen is the virus will not be able to circulate as much and mutate as much.
Dr. Nadelman says she expects us to see less mask mandates in the near future, and she hopes as we approach warmer weather and as people move outdoors that we'll be heading into a more normal state like how life was before the pandemic.